Hello guys, this is Kay from Pod Rainbow Science, and in today's episode we're gonna come back to the HIV topic and we're gonna discuss how to tell if you're HIV positive and if this is possible at all. I hope you're gonna enjoy it. Let's go! Hello once again, I hope you're doing great today. And first of all, I have to apologize you for the sound that you may hear, the sound that may appear in the background, because I have some roadworks nearby and those guys make noise all day long. And since I work from home, I'm kind of at the end of my tether. But, well, anyway. This episode is supposed to be about different things, but I got inspired by a guy who came to my office yesterday, so I thought that it might be a good idea to talk more about HIV. I'm going to describe you just in a few words what happened. Well, a young man, a very nice student, came to my office in order to test for HIV. So as usual, we had a short conversation before the test. I explained him how it works. I told him about window period and other important things that we always tell people when they come for the first time. And while this conversation about the window period, he told me that he had an unprotected sex with a guy about a week ago, but the first contact with the same man was about 4 months ago. So he assumes that the results should be reliable. And so, he counted the window periods since 4 months ago, not since a week ago. So what happened was that he figured out that when someone is HIV positive, the first contact is enough to get infected. So he thought that a chance of transmission is about 100%. And frankly, it is not very unusual. It's not unusual that people think that one unprotected sex with HIV person guarantees or almost guarantees that they are also infected. And well, the truth is that the chance of getting HIV from someone who is infected and untreated, because it's quite important that we are talking now about untreated person, is less than 1%. So, well, the actual and precise odds ratio depends on the form of sexual contact. So, the basic vaginal sex is safer for men, less safe for women. Regardless of the gender, it is safer than anal intercourse, of course. But overall, no matter what type of contact, on average, the chance of getting HIV is roughly 0.5%. However, it's quite important to mention, my friend, who's also an HIV advisor, says that the chance of winning jackpot is even smaller, and still there are people who win. So I wouldn't recommend sticking to those odds ratio whatsoever. Okay, but let's jump to the main topic of this episode. What are the symptoms of HIV and what is going on with your body when you finally get it? Well, first, you obviously cannot identify an exact moment of getting HIV. So there is no acute pain, the virus is not visible, there are no visible changes in your body when you get infected. However, you might have heard about something what's called an acute HIV infection, or sometimes written AHI. And some people within 2 up to 4 weeks after getting HIV may present symptoms of illness. They can resemble flu, they can include fever, chills, night sweats, general fatigue, mouth ulcers, and so on. But I have to mention that according to various studies, those symptoms are present in about 50 up to 80% of HIV patients. So it is not 100%. It means that some people can experience it, some people can be free from the symptoms. And there are a few problems with those studies, but I have to tell you, I think the one that stands out the most is the type of study. Those are mostly retrospective studies, so people who are currently in treatment or people who are already diagnosed with HIV, they're asked whether they remember if they experienced the given symptoms. So, firstly, we assume that people can more or less precise tell when they got infection. And secondly, we assume they remember their medical state after that moment. So, from my point of view as a researcher and also as a human, I gotta tell you that since human memory can be influenced by so many factors, including emotions, age, experience, things that happen later, social expectations, and so on, it is quite risky to rely on people's memory, and I wouldn't do it anyway. So, to sum it up, even if you observe those symptoms a week or two after the potential virus transmission, it doesn't mean you are infected. And conversely, if there are no such symptoms, you cannot assume that you didn't get HIV. So the only way to find out is getting tested. Okay, but let's have a look how the virus operates in the human body from the moment it enters whichever door. So far, we know that HIV can be transmitted from mother to child during pregnancy and delivery, of course when a mother is not treated. It can be transmitted by blood when a person has contact with a visible amount of blood, and this blood gets in contact with a person's mucous membrane. That is when blood gets in contact with person's, for example, eyes, blood, or mouth in most cases. And when people are sharing needles or, other instruments to inject substances. So when blood is on your skin, you don't have, and you don't have any serious scars on your skin, there's no worries. Skin keeps the virus on a safe distance, and it's enough to clean it with just soap and water. Don't wash it with, special sanitizers based on alcohol itself, or other, aggressive liquids, since they can irritate the skin and increase the risk of transmission. Just water and soap is really, really enough. And of course, the final way to get infected is by unprotected sexual contact. And according to global reports, it is still the most common way to get HIV. But let's start with the very beginning. From the moment the virus enters one's body, there is still time to get rid of it and eradicate it completely with something that's called post-exposure prophylaxis, PEP. And according to research, receiving the post-exposure prophylaxis makes sense up to 72 hours after transmission. So, for instance, if you work in a hospital and, accidentally got a needle stick injury, you have 72 hours to get treatment that prevents you from developing chronic HIV infection, even if the virus was transmitted into your body. And likewise, if you had an unprotected sex with someone you didn't know or someone who is HIV positive, you can go and get the post-exposure prophylaxis. And it is important thing to mention that the sooner the better. So receiving treatment after 10 hours is more effective than after 24 hours. Receiving it after 24 hours is more effective than getting it after 30 hours, and so on. And it is believed that getting post-exposure prophylaxis after more than 72 hours from the potential transmission is just useless. So don't drag your feet if you feel you need it. If you can, just go and ask for treatment. But of course, not everybody has access to post-exposure prophylaxis, and not everybody wants to explain to the doctors what happened, because it depends on the place you're living. In different countries or even different counties, the procedure varies. In one place you can get PEP without any questions, just because you ask for it, and while in the other countries you have to have full medical checkup or at least interview with the doctor. So I understand that it may be not comfortable for everybody. Or, sometimes you just simply don't think about it because you meet someone, you like each other, hit it off immediately. It is obvious that HIV is not the first thing that comes to your mind. We've all been there. It happens all the time. Okay, so you got HIV, for example, 3 days ago. Should you, or you don't know it yet, you had an unprotected sexual contact 3 days ago. should you go test yourself today? Well, definitely not, because even though you are already HIV positive, it is very likely that the test you take today will give you a negative result, and you might wonder how it is possible. Well, regardless of the type of the test you get, whether it's NAT or antibodies or antigen test, it is too early to receive the reliable result. It is almost certain that you will get a negative result, so the test tells you that you're fine, while it is not actually true. And since the virus, or to be more precise, a virion, enters your body, you become its host. So it means that each small virion looks for a cell within your immune system. Usually it looks for a so-called CD4 cell, and when the cell is found, from now on the replication cycle begins. I don't really want to describe each step of this process because it probably wouldn't be very interesting for you. But a key message here is that it is not a clean process. I mean, while replicating, the virions leave, let's say, some amount of trash within your blood system. But let's see how it looks. Your CD4 cells, just like every other cell, contains your DNA. And the virion contains RNA. And during the replication cycle, and more specifically during its stage called reverse transcriptase, each HIV virion changes the CD4 cell's DNA. And when the DNA is changed, the CD4 cell can produce new major HIV forms. And the rest of the old virions and as useless it's circulating in your blood system. Alright, so now imagine that hundreds of such virions enters your body, each finds its CD4 cell. One CD4 cell can produce many new virions, and each new virion again finds another CD4 cell, and so on and so on. The replication process during the first week or during the first 2 weeks, during the so-called acute phase, goes really fast, and the amount of the virions we also call the viral load, it is very high. It is also the moment when the chance of transmitting HIV onto other people remains very high, because human immune system can usually fight against some amount of the virus, but when it's so high, even the best working immune system doesn't stand a chance. So this is the moment when you are it is very, 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 very likely, and the chance of transmission is very high. Okay, so the viral load is high after 1 or 2 weeks from the infection, but in the meantime, your body some kind of realizes that something is going on, and it starts to produce antibodies. Antibodies are specific proteins which, in this case, are supposed to guard you against HIV. And antibodies should appear in your blood up to 12 weeks from the moment you got infected. They are usually present after like 7 weeks, sometimes 8 weeks, but 12 weeks is the time when they are certainly present in your immune system. So it means that if you take only antibodies test, so the test which can detect only antibodies, not the virus protein, not the virus itself, only antibodies, and you take this test after 3, 5, or maybe 7 weeks after infection, you can receive a false negative result. So if you have only antibodies test, you have to take this test 12 weeks or later from the moment when you potentially could get infected. Okay, so far so good. Contrary to increasing number of antibodies, the amount of virions decrease because the antibodies and your whole immune system successfully destroy HIV virions circulating within your body. It also means that your viral load is getting lower. So if you're not aware of being an HIV positive person, or you don't get any antiretroviral treatment, This state can last approximately 8 or 10 years. So you wouldn't see any symptoms of infection, you wouldn't get sick more often than usual, your regular blood testing wouldn't be any different from the norms. And we call it a chronic infection or a clinical latency. However, it's worth remembering that small amount of HIV positive people, also called rapid progressors, can experience immune problems earlier, for instance after like 4 or 5 years after infection. And also there are people who are called long-term non-progressors who remain free of immune system decline or other symptoms for like 12 or even 15 years, or maybe even longer. But the average duration of the clinical latency is about 10 years. And until that moment, everything goes along the same lines. So for every person who got infected, the infection goes through the acute phase and then converts to the clinical latency. Of course, if you don't get post-exposure prophylaxis. However, at this point, things can go different. And it depends on whether you take the ARV, antiretroviral therapy, or not. If you are not interested in treatment, after 10 or you don't have access to treatment, after 10 or more years from the moment you get infected, the amount of CD4 cells start to decline and the situation is reversed to the one from the beginning of the infection. Remember that the number of antibodies was increasing while the number of HIV variants was decreasing, and now we have a converse situation. Because after 10 or so years without treatment, your immune system is no longer effective in combating HIV, and the virus is slowly overtaking your body. And from this moment, you can observe worsening of physical health, such as, getting flu or other infections very often, recurring ulcers, visible and rapid weight loss, recurring pneumonia, and sometimes even neurological symptoms such as memory loss, and well, of course, something we know it very well from movies like Philadelphia or Angels in America, that is Kaposi's sarcoma. It's a type of skin cancer. And when these 8 symptoms occur, the prognosis is rather pessimistic. There is not much to do in such conditions, and yet no way to improve the immune system. So it's not possible to fight against HIV in such a serious medical condition. However, if you choose to undergo antiretroviral treatment, the situation is radically different. Since you start taking treatment, the HIV is no longer able to replicate within your body. And if it's not replicating so quickly or in such an efficient way, your immune system, including CD4 cells, can effectively combat it. And by saying effectively, I mean the viral load is so low that it cannot be detected by the regular test. So just to see it more clearly, the regular viral load in the case of non-treated person is as high as 90,000 copies of virus in 1 milliliter of blood, while in the case of person who's on treatment, it is equal to 20-25 copies. So once again, 90,000 versus 20 copies. It's a huge difference. That's why we say the treatment is 100% effective. And further, when you achieve such a low viral load, there is no way to develop AIDS, but also there is no way to transmit HIV onto anybody, even if you have unprotected sexual contacts with people. And we know it from 2 studies. The very famous studies called Partner 1, and the second study was called Partner 2. And I'm going to just describe it in a few words. The study sample comprised of couples where one person was HIV positive and on treatment. Another person from the couple was HIV negative. And the HIV positive persons were analyzed, they all were on treatment, and all of them had undetectable viral load. So they had we can imagine they had about 20-25 copies in a milliliter of blood. The couples declared that during the study, they resigned from protected sexual contacts, and the result of the study remained no doubts, there was not a single incident of HIV transmission from the undetectable person to his or her partner. And paradoxically, that is why we assume that HIV positive person, or who adheres to treatment, those people are the safest sexual partners, because first, they are aware of their stages, and second, they are on treatment. And of course, when you're on treatment, the expectancy of your life is exactly the same as it would be if you were HIV negative. So the quality of life is also no different from any person without HIV. So whenever you hear the undetectable, untransmittable phrase, you'll know that it pertains to having a low viral load, low enough to be undetectable, and consequently low enough to be unable to transmit HIV onto anybody. Okay, to wrap it all up quickly, my takeaway message today is that you can say whether you're HIV positive or not only by taking the appropriate test. It is not possible to diagnose yourself with symptoms of any kind. Additionally, clinical latency, which is a phase of HIV infection, can last roughly 10 years. And during this phase, your CD4 cells are diminishing in numbers and your immune system is less efficient, but it still doesn't give you any clues that something wrong is going on. When during the clinical latency you get on treatment, after just a few weeks the infection is 100% under control, the virus can no longer replicate in your body, your immune system is strengthened, and as long as you stay on treatment, there is no way for the infection to progress. However, when you are not aware of the infection or you don't undergo antiretroviral treatment, 10 or more years after getting HIV, you're gonna develop AIDS, acquired immunodeficiency syndrome. It is the final phase of HIV infection, and during this phase, the visible symptoms of extremely tired immune system occurs. You can experience recurring pneumonia, significant loss of body weight, ulcers, skin cancer, and so on. Usually, when you already develop AIDS, it is very unlikely that your immune system would be repaired and that it would be able to combat HIV because the viral load is just simply too high. Finally, to close this episode with something optimistic, nowadays treatment is completely efficient and successful, and approximately 5 or maybe 6 weeks are enough to suppress the virus to such a low number that it's going to be safe for you and unable to be transmitted onto other people. Okay, so that's it for today. Thank you very much for listening. Thank you for the message after the last episode. And I'd like to say a very special thanks to Aya. Sorry if I mispronounced your name. For the paper you sent me. It was very interesting. Thank you very much. And of course, if you have questions or concerns, just don't hesitate. Shoot me an email or send me DM on Twitter or anywhere else. I'll be happy to correspond with you. Thanks for today. Take care. Share your knowledge, and until the next time. Bye.